While the latest falling COVID rates are heartening to some, they're of little solace to the families and friends of the 700,000 plus who've died from the virus and the many more who've died because of it, even if it's not officially listed on their death certificate. For far too many, it's the decisions of others that are deciding the difference between life and death, as was the case for 83-year-old William Baker, who died a little over a week ago at a hospital in Maine. As his daughter wrote, "For the past 18 months, my sisters and I have done everything possible to keep our father safe from COVID-19. But as she detailed in a recent Washington Post story, he fell and broke his hip. And with rehab beds full, mostly with unvaccinated COVID patients, William Baker was fully vaccinated, faced endless obstacles to a return to health. His greatest fear," his daughter wrote, "was dying alone in the hospital," which is what he did. That daughter, New York Times bestselling author Christina Baker Kline, joins me now. Christina, it's good to meet you. I'm so glad you wrote this piece. Thank you for being here.
Thanks for having me.
So, first surgery failed. Second one is planned for Athens, Georgia. Doesn't happen. Why?
So he had a spot, and we were all set. We'd filled out all the insurance. Everything was a go. And then it turned out that Georgia essentially had a mandate that they would do no quote unquote non-essential surgeries. Any surgery that required an overnight stay that wasn't life or death in the moment, they were postponing. So even though my father was left unable to walk and in constant pain, he was not able to get surgery.
So you brought him up to Maine, where you spend part of your time. He did get a second surgery. It was successful, but rehab was unavailable. Why?
Because of the unvaccinated filling beds. We were told that with a hip replacement, he had no surgery for an 83-year-old is considered routine, I suppose, but it was a very ordinary kind of surgery, a partial hip replacement, which is today not such a big deal. And he'd been completely cleared. And the doctor said he'd recovered beautifully and needed to go to rehab within 24 to 48 hours. For a hip replacement, you need to start physical therapy quickly. And so everyone was ready. My dad was ready. He was up on a walker. He was in great spirits, fully conscious, of course, joking with the nurses. And the days stretched on because the care manager at the big hospital, big regional hospital, very renowned, could not find a bed within hours of the hospital that was available for days. It was 10 days before she finally found a bed, and that bed was in a COVID-infested rehab facility. 20% of the patients had COVID. They were not quarantined from the other members of the rehab facility, and my father would have immediately gone into quarantine there. But even so, that option might have worked, except that he contracted a series of infections, including MRSA, which is a hospital-borne illness, which is common among the elderly, especially in hospitals.
We've talked a lot on the radio and on this show about the unvaccinated in this country, and while it is hard for me to understand virtually anybody who falls in that category, you expand that by a factor of 1,000, and it's impossible for me to understand how someone in the healthcare field can be unvaccinated. But at least one of the people who took care of your father, a nurse, was unvaccinated, correct?
Yeah, the worst aspect of this story, although I'm not sure whether in the end it's what killed him, is that the nurse who was taking care of him was diagnosed with COVID and she was unvaccinated. And there is currently no mandate in the state of Maine for healthcare workers to be vaccinated. Supposedly it's happening October 28th, although it was already pushed back from October 2nd. So fully a month after my father died, there may be such a requirement.
At this facility also, correct me if I'm wrong, only one family member was allowed in per day. And if I'm right about that, can you explain to people why there was that limitation? Who was it intended to protect?
Yeah, it was very strict. We had to stand in a long line. There was one person allowed a day. You were asked all these questions about your exposure to COVID. Your temperature was taken. And when I when I asked a nurse in exasperation why fully vaccinated family members wearing all the protective equipment wouldn't be allowed more than one. I'm one of 4 sisters. So, and we're an hour and a half, we lived on the coast of Maine. We live on the coast of Maine. We're an hour and a half from the facility. So for one person to go a day, it felt onerous. And my father's dear partner was there, who's also 83. So she said, well, honestly, the hospital is afraid of their unvaccinated staff catching COVID. So we're limiting the numbers. And I know it's probably not that simple, but it was such a shocking thing to hear.
How shocking to me is almost an understatement. How do you feel? Your father is denied space in facilities because of the unvaccinated taking up the beds. Your father gets in a COVID-infested facility, and he is treated by a nurse who decides it's appropriate in providing health care to be unvaccinated herself. How did you feel through all this, even when your father was alive?
Yeah, I mean, I did a thing on CNN the other night, and they brought on an unvaccinated nurse who thought that her rights were being abridged by being asked to be vaccinated. And my response is that 96% of new COVID cases are among the unvaccinated, and that their transmission rates are much higher. So why would you ever allow a healthcare professional working with people as my father was eventually, in the gravest of circumstances, why would you ever allow a healthcare worker who's unvaccinated to take care of the vulnerable? It makes absolutely no sense. And the truth is, my father did end up dying with COVID. He caught COVID from this nurse. There was no one else it could have been. Only one family member was allowed. We were in full protective equipment. All of us were vaccinated. And there were only one person allowed, and only one person was there that week.
You don't say it explicitly, but reading this many times as carefully as I could, it is so clear to me your father is no longer alive because of the selfishness, the callousness, the cruelty of unvaccinated people. You don't mention the name of the facility. Why don't you?
It's in other newspaper articles. I wanted to make a larger point. I wrote this op-ed in the Washington Post, and actually thousands of people have responded to it in various forums, and they're all over the United States, because it's not an issue about Maine. It's an issue about the unvaccinated, and in particular, unvaccinated people who are taking care of our vulnerable population. And by that, I mean healthcare workers.
And by the way, I totally respect your decision. My decision is to say it's Eastern Maine Medical Center for those who are curious. We know how your father died, but in so many circumstances like this, we don't know how he lived. I do a little bit. I actually read Jesse Owens, a great book that your father wrote. But can you spend a minute and tell us about William Baker's life?
It's such a lovely thing for you to ask. My father was the son of mill workers. He was the first person in his family not only to go to college, but to graduate from 8th grade. He went on to become a professor of history at the University of Maine. He chaired the history department. He helped to invent the field of sports history, which is now a thriving field. He wrote many books, the last one of which was published by Harvard University Press, about sport and religion and that intersection. And he was beloved by many. I've gotten so many letters from his students over the years who found him, such a mentor and such an example of what someone can do who comes from a family without education when they are given that chance.
Well, I wish I'd known him, but again, I knew him through his writing. So finally, Christina, what's your message to the unvaccinated in general and particularly in healthcare facilities?
My message is that no one can force you to get vaccinated, but if you work with people who are in vulnerable health in any way, you owe it to your profession to do it. There are too many people dying. And I also would say to other unvaccinated people, when you yourself get ill, you're taking a bed away from someone who's sort of followed the rules and done everything they could. We spent 18 months trying to keep my dad safe from COVID, only to have him contract it from a healthcare worker in the hospital. How ironic is that?
Everybody should read your piece. Christina, I really appreciate your time. Thanks so much for sharing it with us.
Thank you so much.